I'm Rachel Murphy. I'm originally from Ontario and I obtained my PhD in nutrition from the University of Alberta. I'm now an associate professor in the School of Population and Public Health at the University of British Columbia, and I'm a scientist at BC Cancer. And I am leading the Heal and Charm studies along with a great team of investigators and staff and trainees from across Canada. I'll just briefly introduce my co-presenter, Dr. Jennifer Bennett, before I kick things over to her. Dr. Bennett is the scientific director of Alberta's Tomorrow Project and a research scientist at Cancer Control Alberta and Alberta Health Services, and one of the leads of HEAL as well as CHARM.
Perfect. Thanks, Rachel. And Rachel also humbly didn't mention that she was the main driving force between getting the funding for the studies that we're going to talk about now. So we're very grateful to have Rachel on board and leading this charge in CanPath with myself and Dr. Sharon Kirkpatrick, who's at the University of Waterloo. So I think as the previous studies have alluded to, as a CanPath participant and as a participant in your regional study, you really have the power to change the future. Your data is already contributing to a number of amazing studies across the country. And we're going to tell you about how you have the opportunity to do that again and continue to do that with diet and activity data. So we're going to talk about why we want to hear all about what you eat, what you do during your day, including everything: sleeping, working, volunteering, taking care of your house, your yard, and your kids. So I just want you to take a minute to think about what you've eaten so far today and what you've done. And then I want you to think about why you've done those things. Like, what has helped shape what you chose for breakfast this morning and the activities that you've done so far in your day. So for example, I too have a little bit of cold, just like Trevor, and my 3.5-year-old son decided to wake up at 5 in the morning, which is 2 hours earlier than normal. So that definitely affected my morning so far and will probably impact my day going forward. Because it affected my sleep. I'm probably going to be hungrier. I'm probably going to be less inclined to be reaching for the carrots and broccoli for a snack, for example, and more likely to reach for another coffee. So there's those sort of closer things that can impact what we do, like our health and our personal preferences, our normal routines. But there's also broader factors that can influence things that we eat, the foods that we choose and the activities that we do, and things that we don't maybe even really realize, like the types of marketing and media that we're exposed to and the environments in which we live and work and where we choose to spend our time. So the HEAL study, or the healthy environments for, what is it again? Healthy eating and supportive environment study. I talk about this study all the time. We're specifically interested in the environment. Both the physical built environment, what you would normally think of when you think about your neighborhood, right? Like the options where you have to be able to walk, maybe spend time in a park or a green space, the type of transit that you have or facilities around you. And then also more specifically, what we call the food environment. So this is where you can get access to food. This could include your garden in your backyard or your home, but it can also include like the convenience store, how many grocery stores and what they have available to you. So for example, we have a couple of grocery stores that are reasonably close to us. If it's a nice day on the weekend and I have time, I'll take my son in our little wagon. We'll go for a nice walk to the grocery store. We'll pick up our food and go home and make supper. But if there's a snowstorm in Alberta, or if I'm busy on a weekday, I'm going to choose to drive there instead. So a lot of things will affect how we access food and what is available to us. Excuse me. So as Trevor mentioned, a significant number of cancers could be prevented at the population level, or there's a lot of things that you can do to reduce your risk at the individual level. And part of this is through eating well, being physically active, having a healthy body weight, and not smoking. And often the health guidance really focuses on what you as the individual can do to eat healthy and move more. But we know that there's all these other structural and system factors that influence the choices that we are able to make. So by studying the broader environment, we can better understand how structures and policies and programs can really help support people to make the healthy choice, the easy choice, to help with your individual risk and help prevent cancers and chronic diseases on the population level for hopefully generations to come. So I think as Vicky and Trevor really beautifully highlighted, Canada is actually one of the world leaders in measuring aspects of the environment, both from the sort of pollution level, as well as the structures. Like Trevor mentioned, the Canoe Project, which will map out access to green space and walkability and things like that. But where we're really lacking is very, very good data on what Canadians eat. So most surveys will only ask you about the fruits and vegetables you eat, which is great. It's a marker of a healthy diet, but then that's really all you can talk about. There's nothing else about the rest of the diet, which also might be important. So some of the regional studies in CanPath, like Alberta, Quebec, and the Atlantic provinces, we have asked you before more detailed information, but honestly, this was quite a long time ago now, and we know that what you eat can change over time for various reasons. And then also, if you just think about how the food available in grocery stores and elsewhere has changed over the last, say, 10, 20 years, it can be pretty significant. So we want to be able to capture those changes. And there's really no other data set in Canada available now that has measured at a really detailed and descriptive level what people eat and also how they move. So this is going to actually fill a major gap in Canada. And so the HEAL study is going to include all of the regional studies in CanPath from BC all the way to the Atlantic provinces. Cartagena, if you're in our Quebec cohort, you don't see your logo there, but you are participating indirectly through another study called the Nutri-Quebec study, and we are working very closely with them to make sure that we can line up as much of the data as we can. So this HEAL study is going to be the largest collection and most detailed collection of diet and physical activity data in Canada ever, as far as we know. And so we're hoping for at least 100,000 participants to take part. You'll receive an invitation for this through your regional study. And if you're in Manitoba and BC, I think Atlantic provinces, you may have already received it. So please check it out and take part. And if you haven't received anything yet, just wait because you might be getting it soon. And so what we're going to be asking you to do is fill out a brief survey about you that will collect some background information. And then we're going to ask you to fill out some surveys that will ask about what you ate and drank and all the activities you did over the previous day. And we're going to ask you to do that a few times over the course of the year. Because like we said, these things can change day to day, and they can also change over time. And so if we ask you to do what you did the previous day, hopefully it's a little bit easier to remember, and you can give quite a bit of detail about, say, what you had for breakfast, where you consumed that, did you make it at home, did you have it on the go, etc. As well as how you moved, including sleeping, taking care of kids or others, volunteering, working, leisure activities, basically how you spent your day for a full 24 hours. And then approximately at the 1 year mark, we're going to ask you a different set of questions that try to capture what you did over the previous year. And this is really to help fill in gaps. So when we ask you what you did the previous day, we might do that in the spring and the fall. And that obviously leaves out the summer and winter where we know activities can be a bit different. And so the past year questionnaire is going to try to help fill in those gaps. Okay, so now I'm going to pass this over to Rachel to talk about the CHARM study.
Thank you, Jen. As Jen mentioned, the next study we'll talk about is called CHARM. It's quite a mouthful title, so that's why you'll hear us referring to things as CHARM and HEAL. CHARM is a sister study of HEAL, and we know that a one-size-fits-all approach to health and cancer prevention in general is limited in effectiveness. And the reason for this is because we know that people's preferences, where you live, your metabolism, they're all different. So CHARM really aims to embrace those differences in biology, genetic, environmental factors to help us understand why some people stay healthy and others go on to develop diet-related diseases, including cancer. The other really important aspect of CHARM to highlight is that CHARM is focused on achieving equitable health outcomes. And by that, I mean, we know that there are people and groups in Canada termed structurally excluded who are more likely to develop diseases like cancer and may also be more likely to face challenges with eating well and being physically active. And CHARM is intentionally inviting participants who are structurally excluded to ensure that the evidence that we generate in this study is inclusive of the diverse populations in Canada. So CHARM will include about 4,500 participants who are taking part in the HEAL study. Invitations to join the CHARM study will start to be emailed over the next few months and into the spring. And participants who are part of the BC Generations Project, Alberta's Tomorrow Project, and Manitoba's Tomorrow Project may be contacted for this. And as a participant in CHARM, you'll have already completed most of the questionnaires in HEAL. So we are not asking people to do extra diet or physical activity questionnaires. The extra piece of CHARM is that we are asking participants to provide one stool sample using a kit that would be mailed to your house or that would be provided at a local lab or study center. And we're also asking participants to provide a blood sample, which again would occur at a local lab or at a study center. The stool sample will be stored, so in the future we can measure the types and amount of bacteria in your gut, also known as the gut microbiome. And blood samples will be used to measure health markers like blood lipids, blood glucose, as well as biomarkers of dietary intake. So this is a question that I saw in some of the questions that were submitted by participants here today. So really, how are we going to be using the data that are generated in HEAL and CHARM? So along with myself and Dr. Bennett and our team, we'll be answering the questions in HEAL around dietary intake and movement behavior and the environment. But the impact is really much bigger than this. So your anonymized data will be available to researchers across Canada to answer a whole range of questions around how nutrients in your diet and what type and amount and what combination can help prevent cancer. So I've just put some examples here of the types of questions that we would be able to answer with this really detailed data on diet as well as movement behavior. And then in the future, we'll be able to look at questions around how does what you eat impact your gut microbiome, for example, and how can this help us really inform evidence and policies to help people live long, healthy lives. So just I'll wrap up in the next couple of slides. I know you've been on this town hall for quite some time now, so just really want to say thank you so much for being here today, and really we are looking to you to help us meet our research goals in HEAL and CHARM. So our goal is really to have about 100,000 participants enrolled. So far we've reached over 3,000 participants. So we have a long ways to go, but we're really excited to be doing this work, and thank you to those of you who have already participated. And lastly, thank you so much for listening to us. If you want to learn more about the HEAL and CHARM studies, you can use your phone to take a photo of the QR code, which is on the slide here. This will open the HEAL and the CHARM web pages, or you can also find it on the CanPath website. So you can see the CanPath address there, and then you'll be able to find more information about the HEAL and CHARM studies. And thank you so much, and I'll turn things over to Phil.